This used to be the typical scene from Michael Gilpin.
I think a big part of my addiction is like trying to escape how these meds made me feel because they weren't the right ones for me, but I just had been doing it for so long that I didn't know anything else.
And that's more common than you'd think. Gilpin suffered from an addiction due to overprescribed medication, a growing epidemic that isn't being talked about. Doctors prescribe insane amounts of painkillers for small medical problems, feeding addictions and fatal overdoses for their patients.
Prescription opioid overdoses and illicit opioid overdoses together account for more deaths in the United States than automobile accidents.
Doctors prescribe Percocet pills like these for a range of illnesses, anything ranging from ADD to minor back pain, even to cancer. These prescriptions are often for 300 pills in 1 month, which is roughly 10 pills per day. And most doctors truly believe this is the best method for pain relief. However, these prescriptions often last for months, and once the patient becomes addicted, they keep adding more to their stock, feeding their addiction and often leading to use of illegal narcotics such as heroin. But this is completely avoidable. Studies have shown that high-strength Advil and Motrin are actually better at managing short-term pain. It's also easily accessible and doesn't cause addiction. UNC nursing student Morgan Mikula says that doctors aren't completely to blame for this. It's partially misused by the patient.
They're not a problem in the hospital for the most part, but the problem becomes when the patient might not know what to do with the medication or they're discharged on too much of the medication, and it can turn into a problem of addiction and abuse.
While both patients and doctors may be to blame, Gilpin believes that the solution might be alternative medication.
This could have come in as maybe alternatives to pain meds in general, and maybe not like less or more of the same thing, but maybe like more holistic ways to deal with pain or like something like that.
In Chapel Hill, I'm Bailey Ingalls reporting.